So in this video we are going to talk about the cervical musculature which are responsible for cervical movements and resisted range of motion examination as of the continuation from my previous two videos, active range of motion examination and passive range of motion examination for the cervical spine. Now we'll start with the resisted range of motion examination for the cervical spine. It's very important. Resisted range of motion examination will provide important information about the muscle strength, state of the muscle, and evaluates the muscle strength separately, like on the opposite group of muscles. So if one muscle is weak or the other muscle is tight. Now, in order to check the resisted range of motion for the cervical spine is in a resting position. Apply the counter force accordingly and give the command like don't let me move you. Now, one example I want to give you is cervical spine flexion. So cervical spine flexion will examine the 11th cranial nerve or the spinal accessory nerve or myotomes C1 and C2. In cases of nerve injury, it also evaluates the structure that is injured or impaired. In cases of neuropraxia or axonotomesis nerve injury, patient may have residual muscle weakness with or without muscle atrophy. So it also evaluates the nerve injury or the suspected nerve level injury. Resisted range of motion examination are all four: flexion, extension, side flexion to the left and right, and rotation to the left and right. And place your hand placement accordingly. Now we'll come to the very important part of this video, is the muscles that are responsible for cervical spine. We'll talk about sternocleidomastoid, trapezius, levator scapulae, erector spinae, suboccipital muscles, and deep neck flexors. So starting with the sternocleidomastoid muscle. As the name suggests, the sternocleidomastoid muscle starts from there are two muscles, left and right. So sternocleidomastoid muscle starts from behind your ear, starts from a mastoid process and runs down. It has two heads, sternal head and a clavicular head. Now, if you see the nerve supply, it is supplied by the spinal accessory nerve and direct branches of a cervical flexus nerve. Action, very important. So if unilateral muscle contracts, if just one sternocleidomastoid muscle contracts, it side flexes the neck to the same side and rotates to the opposite side. But if both the sternocleidomastoid muscle contracts, it leads to cervical flexion or neck flexion. Coming back to the second muscle, trapezius. As the name suggests, is a big trapezoid muscle. Start from the base of your skull, goes down to the cervical and thoracic spine, and out to the spine of scapula. It originates from the external occipital protuberance in a spinous process from C7 to T12 vertebrae. Insertion on lateral third of clavicle, acromion, and spine of scapula. Nerve supply, very important. Spinal accessory nerve and cervical nerves from C2 to C4. Action. So if bilateral contraction of the trapezius will lead to cervical extension, and ipsilateral contraction will lead to side flexion of a neck or side flexion of a cervical spine. Trapezius muscle fiber. Trapezius has three types of muscle fibers: the superior or the descending muscle fibers, middle or the transverse muscle fibers, and inferior or the ascending muscle fibers. We'll come about the next muscle, that is levator scapulae. Levator scapulae is a very important muscle because it attaches the upper limb to the vertebral column. It originates from the posterior tubercle of the first four cervical vertebrae, C1, C2, C3 and C4. It inserts on the vertebral margin of the scapula, or to be specific, from superior angle to the base of the spine of the scapula. Nerve supply by the dorsal scapular nerve C5 and cervical nerve C3 and C4. Action for the levator scapulae is it elevates the scapula. If you stabilize the scapula, the levator scapulae will side flex the neck, and levator scapulae helps to stabilize the vertebral column in case of cervical rotation. Coming to the next muscle group, erector spinae. As I said, it's a muscle group because it starts from it covers the cervical spine, thoracic spine, and even the lumbar spine. It is a very important muscle, helps to improve the posture, helps in neck extension and neck rotation. There are 4 muscles just for the cervical spine: splenius capitis, splenius cervicis, iliocostalis cervicis, and iliocostalis thoracic. Now, if both the side of the erector spinae contracts, it will lead to cervical extension, and if the same side or the ipsilateral side of the erector spinae contracts, it will lead to rotation and side flexion of the vertebral column. Ipsilateral side flexion and same side rotation. We'll talk about the deep neck flexors. Deep neck flexors are again the important muscles. 4: rectus capitis anterior, rectus capitis lateralis, longus capitis, and longus colli or longus cervicis. It's located anterior to the cervical spine, and it is a very important group of muscles. It's the only antagonistic muscle that is to the large group of the neck extensors or cervical extensor muscles. It is important because it helps to improve the posture. It prevents the forward head posture, it prevents the neck pain, and it even prevents the cervicogenic headache. So clinical significance for deep neck flexor strengthening is all the cranium and cervical flexion exercises. So craniocervical flexion exercises will prevent the neck related pain or cervicogenic headache. The last muscle group I want to talk about is the suboccipital group of muscles. So suboccipital group of muscles is 4: rectus capitis posterior major, rectus capitis posterior minor, obliquus capitis inferior, and obliquus capitis superior. This muscle attaches from the base of the skull to the upper part of the cervical spine. It helps on the cervical extension and rotation of the cervical spine. Thank you.